السلام عليكم دكتور نادر and everyone. Good
عليكم
afternoon.
السلام ورحمة الله. يا هلا. السلام عليكم everyone. Today we're gonna have
عليكم
a
السلام.
meeting. So, Dr. Raya, go ahead.
Hello, everyone. Today, our white team will present 4 topics, and we're going to start with polypharmacy in older adults, and it will be presented by Dr. Elmoez. So go ahead, Dr.
Assalamu alaikum, guys. How are you? I'm Dr. Elmoez. Today, I'm gonna present the polypharmacy in older adults. This topic, I think it is a big topic, but I will give only a small clues regarding this polypharmacy in older adults. So we'll start by the objective of this presentation. The first one of our objective is to identify the factors that contribute to polypharmacy. Our second objective will be to explain the consequences of the problematic and to take many medication in older adults. Number 3, to describe a structural approach to the detection of problematic polypharmacy. Number 4, to apply the general strategies to limit problematic polypharmacy. Number 5, and this will be the last, to apply the senior friendly care approach to the polypharmacy. So we'll start by defining the polypharmacy. So if we start, what is a polypharmacy? Polypharmacy, by definition, it is referred to the use of multiple medication by an individually, typically involving 5 or more drugs concurrently. So we can take 5 or more than 5 drugs. This will call polypharmacy by one patient. Approximately 40% of older adults will take 5 to 9 medication, and we have 18% of older adults take 10 or more medications. What is the prevalence of polypharmacy? If we take the prevalence rates of the polypharmacy, the prevalence rate will be various from across the studies and populations. This differ from according to the studies and according to the different population, especially in our specific elderly group in adults. Also, according to the systemic review published in the Journal of American Geriatric Society, the prevalence range from 30% to 70% of older adults. Number second factor is the number of medication used by the patient. As we know, many elderly patients, they have multiple diseases, so they are taking many medication, maybe 2 or 3 or more than 5, and this will cause the polypharmacy. So if the patient is taking more than 5, this will prescribe as polypharmacy. What is the relation between polypharmacy and age? The likelihood of polypharmacy is increased with age. This depends on how many diseases that the patient had. As a study published in Age and Aging found that among adults aged 65 to 74 years, the prevalence was 40%. Polypharmacy, the last factor is the polypharmacy and comorbidities in the patient. Older adults with multiple chronic illness are more likely to experience polypharmacy as they have multiple disease or chronic illnesses. So they are taking many medication at once. These all statistic highlights the significance and prevalence of polypharmacy in older adults and emphasize the need for effective strategies to address the medication management in this population, elderly adult. So the most important question here, what is the risk and consequence of polypharmacy, or to how, what is the sequence and risk to the patient who are taking more than 5 medication? The first and most important risk and consequence is the side effect of these drugs. As we know by logic that if the patient is taking only one medication, he may be experience one side effect or 2. But if he is taking more than one drug, this will put him under the risk of many drug interactions or drug side effect. The second most important medication non-adherence, as the complexity of medication leading to non-compliance, and this will lead to increase the risk of treatment failure and hospitalization. And this non-compliance it is also understandable. So if the patient is taking one, this is different from that one who take 4 or 5 drugs. that he will miss or 2 or 3 medications. This will lead to the treatment failure and increase the percentage of hospitalization in this age group. Number 3, risk and consequence is the functional decline and cognitive impairment. This may be either if the patient complication has Alzheimer's disease or as a neurological deficit, or the patient side effect of some medication that will affect his cognitive impairment. Also, this polypharmacy will increase the risk of falls as a side effect of medication or the consequence of some disease which a patient suffer from, and also increase the percentage of fractures in this age group and cognitive declines. Number 4, we have the increase the cost of medication. Also, this affected, if the patient is taking only one medication, the cost will be less. If he's taking more than 2 or 3 or 5 as a polypharmacy, this will affect his financial issues. The most important thing is that if we have a multiple medical problem, and there will be multiple medication side effect, and this depends on the treatment guideline-based prescribing promote multiple medication. The side effect and the prescribing cascade also will affect this polypharmacy and the side effect of the medications. And the most important factor that affect lead to the risk factor and side effect is the infrequent medication review by the providers. What is the strategies to address the polypharmacy? Number 1, we have to review the medication and optimize the dose and the medication of the patient to be reviewed frequently. Number 2, to improve communication between the providers and the patient and to care coordinations. Number 3, patient education is a very important cornerstone step in the to address the polypharmacy in this patient and empowerment. Number 4, the health information technology integration. This system will help the patient if they have alert either in their phones or the patient, our doctor office. If the patient is not taking his medications, there's an alarm system that will remember the patient or the provider that the patient is not taking his medication. So he will go and take his medication, because any missing of these doses will lead to the medication failure and will lead to hospitalization, increased risk. Number 5, interprofessional collaborations. What is the strategies to limit the potential harm due to polypharmacy? What we can do to decrease the harm of the polypharmacy? The first thing, to assess the polypharmacy risk of any medication used by the patient. Number 2, to review the medication annually in older adults by the providers. Also, to inform the caregivers as patient families or caregivers of the medication change to increase the chance of detecting problem as soon as possible. This will lead to decrease the failure and risk of hospitalization. Also, to choose the medication with the fewest side effect. This will affect also the side effect of polypharmacy. Number 5, to stop unnecessary medication also. All this step depends on the caregiver. So health education and assessment by the caregiver, it is the most important step here to decrease the risk of hospitalization and side effect. Number 6, to consider the impact of medication on quality of life also. To consider the person's ability to take medication and remember to take them, as we mentioned before. This will be most important to use our phones or the application to alarm the patient if he is not taking his medication or if there is any drug interactions. In medication addressing, there is a polypharmacy, there is medication assisting framework. We have 2 tools to detect this problem. The BRIDE tool is the number 1. There is a 7 step in this BRIDE tool. BRIDE stands for each step, first letter. Number 1 stands for D, it is the dose and frequency of medication. Number E is the effect of medication. Number 3, it is the benefit of this medication. R stands for the risk. Indication for I. D stands for the drug monitoring and expectation. This is the end 7 step in the review process of the BRIDE tool. We have another medication assessment framework. This includes medication appropriate index, MAI. Also, we have no tiers and armor. All this framework assessment tool to assess the patient polypharmacy and to address the effect of this medication. We have approach called the senior friendly approach. This very important approach also to process the polypharmacy and very important step in the care of the patient. This depends on organization support, emotional and behavioral environment. Also, we have physical and clinical care and research, and to assess the physical environment of the patient also. To summarize this, we have the polypharmacy, as we said, that is common in those 65% and above, as they have multiple illness, so they are taking medication. So we have to discuss and educate the patient about their medication and also the caregivers. Due to, as we said, that due to multiple conditions require medication, and polypharmacy can be appropriate or problematic also. Also, we have to discuss the risk of harm increase with polypharmacy and illness. This depends on patient education also. Medication appropriateness may change over time to decline the function of reserve of organ, as this will be a side effect, may lead to failure of the system. So we have to take care and to review the patient medication annually or frequently every 6 months as a frequent checkup. To maintain the medication may become harmful. Our last slide will be recognize the problematic polypharmacy will be, it is a very difficult, very difficult condition because it depends on many factors, depend on the caregiver factor, depend on the providers, and depend on the patient, and also depend on how many medicine are being taken by the patient also. As we mentioned here, medication problem can occur without a change in medication because it is a multiple medication. So if there is any change or any side effect, this will be a problem because the patient is not taking only one medication. He's taking more than 5. This in itself, it is a problem. Number 2, each patient is unique. Medication decision requires a very important step here also as a discussion by the provider to the patient about the important to be checked their medication side effect and drug interactions. All care provider can contribute to medication problem identification and reporting system. As we discussed before, the benefit and harm ratio can change in an instant to gradually over time. Regular medication review provide an opportunity to detect problem. This is the most important step here in the polypharmacy to review the medication by the provider. The last one, adjust dose based on changing physiology and consider medication de-prescribing. Thank you so much. Any question?
If
Hello?
yeah, we can hear you, Dr. Elmoez.
My voice was clear. I finished.
Yeah,
already.
yes.
Okay.
Thank
you.
well.
Alhamdulillah, I was not talking to myself. Yeah, any question, guys? Anyone is in the stage? Any question?
I don't see anyone asking any question. So
Okay. Thank you.
Thank you so much.
No problem.
Thank you.
Thank you.
If there is any question for Dr. Elmoez, we can move on to our next presentation, and it will be rehabilitation, and it will be presented by Dr. Ladin. So Dr. Ladin, if you are ready, you can start.
Hi everyone. I'm Dr. Ladin Salahuddin. I'll be presenting today's session about rehabilitation. Can you hear me all?
Yes.
Yes, we can hear you.
Can you see the screen?
Yes.
No.
Yeah.
Yes.
We can see.
Okay. So today we'll be talking about rehabilitation. The important objectives to know about this presentation today is to be able to describe the systemic approaches to assessment of the causes of disability, the advantages and disadvantages of potential sites of rehabilitation care, as we're going to know that we can do the rehabilitation inside and inpatient care and outpatient, the role of interprofessional teams, and care of plans, how to adapt care to comorbidities and disabilities that are found in each patient, and how to personalize the plan for rehabilitation for each patient, the basic requirements for rehabilitation of common conditions. The topics that are covered today, as mentioned in this list, and we are going to talk about the conceptual model for geriatric rehabilitation. Geriatric rehabilitation assesses the status and the needs of patients, matching treatments with specific conditions and evaluating rehabilitation outcomes. The World Health Organization International Classification of Functioning Disability and Health Framework for rehabilitation, the health conditions of the patient, and the consensual factors. What do we mean by that? Is that the daily functioning are viewed as outcomes of interactions between health conditions like diseases, disorders, and injuries, and the contextual factor, which include both the environmental and personal factor. Environmental, like the settings where the patient lives in, and personal factor like the race, the age, and factors that affect the patient personally. The sites for rehabilitation can be inpatient and outpatient. For inpatient rehabilitation, we have rehabilitation hospitals that can be freestanding hospital attached to acute hospitals, and we have skilled nursing facility. On the outside, a patient can take care in hospital-based clinic, independent clinics, day hospital settings, or at home. For choosing the sites, now show correlation between sites of care and the outcome. Can you hear me, guys? Is the internet good?
Yes, we can hear you.
Okay. Outcome of patient with stroke or hip fracture is best after acute rehabilitation. A physician should consider and put in mind the severity of impairment, need for ongoing medical management, functional status, ability to withstand the activity, social support, need for full-time caregiver, and the insurance plan. The teams and roles. The professional team to ensure patients receive efficient and effective care, consisting of comprehensive assessment and interventions for the disabling illness and comorbid condition, and the specific impairments and environmental factor that may affect the activities and participation. The patient and family are core member in the treatment, and they should be involved in the plan for each patient. Their expectation and their preferences must be considered. Also on team, we have the nursing staff, speech and language therapy, social work, psychology, nutrition services, orthotic and orthotic and physicians. The impact of comorbid, yes. Hello. Can you hear me?
Yes, we can hear.
Impact of
Yes.
comorbid conditions. Yes, comorbidities may interrupt and may delay the treatment and often require adaptation in the care plan. Many of the illnesses that can interfere with rehabilitation of older adults are predictable and potentially preventable. So a systematic approach to assessment, prevention, and management of comorbid condition improves the chance of maximal benefit from the rehabilitation. You have specific comorbid conditions to discuss. First, there's reduced mobility, high risk for skin breakdown, resulting in pressure ulcers. So clinicians should monitor the pressure and weight-bearing areas, modify footwear, wheelchair, and bedding as needed. There's also thromboembolic events, so prophylaxis for clots should be also put in mind. Incontinence, a structured approach to assessment and treatment of bladder problems should be incorporated into the rehabilitation services. Pneumonia is also common in bedridden patients, so risk is increased by inactivity, disorder of swallowing, and underlying lung disease. So clinicians should be aware of the risk of aspiration and modify diet as needed. Anemia is associated with adverse outcome, including functional impairment, decreased muscle strength, and poor quality of life. Cognitive functioning through mental functioning is critical for rehabilitation, which requires the ability to follow commands and learn. Clinicians should be alert for delirium and screen for mental status and easily reversible causes. Depression is also common for a patient who has recent disability. So it's endemic in newly disabled individuals and can manifest as low motivation. So clinicians should screen for depression and intervene early with treatment. Seizure can develop after stroke. Spasticity can develop during the stroke recovery. Interventions include physical therapy, muscle relaxant, or botulinum toxin can offer modest benefits. However, these benefits have not translated into improved function. Diabetes and rehabilitation. Diabetic patients are likely to experience changes in glucose level and medication requirements. So activity level is a powerful factor in glucose metabolism, and increased caloric intake during recovery may also affect the medication needed. Therapy personnel should know how to assess diabetic control, use a glucometer, and intervene for hypoglycemia. Cardiovascular diseases and rehabilitation. Patients with poor cardiac output may have extreme exercise limitation. Abnormal gait in patients with coronary artery disease may worsen the coronary symptoms, and patients with one vascular disease often have others. Peripheral vascular disease is often associated with an insensitive or painful feet and have high risk for skin breakdown. Comprehensive assessment for the primary components of comprehensive assessment: patient demographics, social support, home situation, number of steps for in entry and location of the bathroom, medical comorbidities, severity of current illness, prior functioning status, and medication reconciliation. Comprehensive assessment for rehabilitation in patients is necessary for appropriate clinical management and for evaluation of outcome. So the treatment plan should be guided by the result of the initial assessment that we do for each patient. We assess the impairments, deficit in range of motion and flexibility, the strength, sensory functions, balance, cognition, depression, swallowing, language, and quality of life. Stroke is one of the causes of impairments in movement, and one of the conditions that we use rehabilitation for. People over 55 years of age are at highest risk for stroke, and acute stroke occurs in more than 800,000 people per year in the US. More than 80% are likely to survive, many with residual neurological difficulties. Stroke-related defects are severe, but 1/3 of patients survive. The goals in rehabilitation of patients with stroke is that recovery for older adults with stroke is complex because of the variability of causes, the symptoms, severity, and recovery. Regaining functioning, compensating for and adapting for functional losses, preventing secondary complications, assessing the patient, reintegrating into the community. What to expect from rehabilitation in patients with stroke. The patient usually recover to some degree. Recovery is most dramatic in the first 30 days and may continue more gradually for months. Number of defects affect degree of initial recovery. Time to maximal recovery also is affected. Many patients with mild or moderate stroke become independent in acute daily livings, but other aspects of health status might be affected. The guidelines for rehabilitation in patients of stroke. The stroke severity should be assessed with a stroke scale, and outcomes are best with coordinated interprofessional stroke-specific care. Therapy should start early, but later supplementary interventions may help. the approaches to rehabilitation, neurophysiological approach, constraint-induced movement therapy that encourages patients to use the affected extremity, treadmill walking with partial body weight support, speech and language therapy, cognitive retraining for attention or visual spatial deficit, compensatory training for short-term memory deficit, medication for depression and emotional liability. Preventing recurrence of stroke, assess patient for significant carotid stenosis and atrial fibrillation, review indication for carotid endarterectomy and anticoagulation with warfarin or ravoxaban, consider antiplatelet medication, angiotensin converting enzyme inhibitor or statin, and target hypertension and smoking. One of the other causes of impairment in old patients is hip fractures. It affects 300,000 people per year in US, 90% as a result of a fall. Mortality is approximately 5% during the initial hospital stay and 25% in the year following fracture. 25% of patients recover to prior level of function, but up to 50% of those require an assistive device. About 50% of patients require transient long-term care, and about 25% of those remain in long-term care 1 year later. The goals of rehabilitation in hip fracture is to manage pain, mobilization, and prevention of complications such as delirium and thromboembolic events. Key factor influencing recovery are early mobilization and how frequently therapy is provided. Acute rehabilitation after hospital discharge appears to result in superior outcomes. Medical management in hip fracture include interventions to relieve pain and to restore bone alignment to allow fracture healing and to prepare older adults to return to their prior level of functioning. Evidence that co-management by geriatric and orthopedic surgery can result in improved outcome, reduce length of stay, low complication rates, low mortality, and reduce the cost. Co-management services need to be interprofessional with shared decision-making, equal responsibility for the patient, and daily communication. The surgical repair options for hip fracture. Early repair that occurs in the first 24 to 72 hours after fracture reduces 1 year mortality and complication, such as pressure ulcers and delirium. Delayed surgical intervention is warranted for medical unstable patients. Surgical approach is determined by the location of the fracture, the presence or absence of displacement, and the pre-fracture mobility status of the patient. Fracture of the femoral neck, where there is no displacement and intact blood supply, we corrected with screw. If there is any degree of displacement and or poor circulation, usually is treated with prosthetic femoral head, hemarthroplasty. If there is displacement or significant underlying bony acetabular disease, we manage it with complete hip arthroplasty. And immediate weight bearing is usually okay, regardless of the surgical technique used to manage the fracture. The intertrochanteric fractures, the treatment of choice is open reduction and internal fixation with compression screw or similar device. If joint is unstable, full weight bearing is often not allowed for up to 6 weeks. Mobility preference can be assessed with the Harrison Hip Questionnaire and numerous other instruments. The prevention of recurrence of hip fracture, diagnose and treat the osteoporosis and the balance problem is key, and hip protectors do not appear to decrease the incidence of hip fracture in community living older adults. Total hip and knee arthroplasty. In the US, joint arthroplasty is the most common elective surgical approach in approximately 400,000 yearly. Primary indications are progressive pain and limitation of mobility despite conservative care. Plain radiographs are the usual method for determining the severity of joint damage at both the hip and the knee. Long-term results with significant pain relief and improved function. Success rate is about 90%, 10 to 15 years after joint placement. Implant loosening is most common reason for failure. The types of surgery used for total hip arthroplasty, the prosthetic and approach used to total hip arthroplasty are determined by the surgeon and based on the condition of the joint and the integrity of the bone. So there is anterolateral approach and posterolateral approach. Anterolaterally, the precautions used to avoid external rotation, adduction, and extension. Of the operated leg for approximately 6 weeks, and for the posterolateral approach, do not internally rotate. We do not internally rotate or adduct the leg, and do not flex the hip beyond 90 degrees for the first 6 weeks. Many surgeons use minimally invasive technique and result in quicker recovery. Various types of prosthetic knee are also the type used depend on the joint damage. Typically, patients can begin bearing weight on the operated leg by the first day or two after surgery. The precautions are to rotation or torsion of the knee should be avoided for up to 3 months, and surgeons are using minimal incisions to achieve greater neck flexion and decrease blood loss and length of the stay. Immediate postoperative period for total hip and knee arthroplasty. It's managed by anticoagulation with low molecular weight heparin or adjusted dose of warfarin. Pain control is needed, and often with opioid. Early mobilization is standard for care. And for patients at high risk, like 70 years or older, or have 2 or more comorbidities, inpatient rehabilitation improves the function and decreases the length of stay. To decrease the risk of dislocation, patients should avoid motion, such as bending over to tie shoes and crossing their legs. A raised toilet seat and top bench are recommended for the first few postoperative months, and rehabilitation focuses on muscle strengthening, especially the abductors. Recovery of range of motion is key to return to function. Continuous passive motion machine decreases need for manipulation. Combined with physical therapy, it increases range of motion and decreases the length of stay. And to reduce swelling, we have compression stocking and cryotherapy. For lower extremity amputation, necessarily for more than 120,000 people in the US, most have a systemic vascular disease. Mortality is up to 50% at 2 years and 70% at 5 years. For up to 20% of patient, amputation of contralateral leg is needed within 2 years. The rehabilitation for patients with lower extremity amputation. Preoperatively, there is strength and flexibility exercise and education about the recovery process. Also, pretension of contraction, wound healing, edema control, shaping of the stump, and psychosocial support. Phantom limb is one of the phenomena that is common to occur in 60 to 80% of patients, and the treatments remains difficult. Facilitate systemic assessment. The key factors is to assess the prior functioning status, the stability of comorbid condition, cognition, the upper extremity use, conditions of stump and other extremities that led to the amputation is important. To know the underlying cause that led to the amputation is important for the management and to prevent the amputation of the contralateral limb. For cardiovascular or for cardiac rehabilitation, an individualized medically supervised exercise program combined with an interdisciplinary focus on psychosocial, nutritional, and heart disease risk factor reduction of life, and to reduce the mortality. Barriers to utilization are low physician referral, lack of personal resources, and difficult attending. For pulmonary rehabilitation is defined as comprehensive intervention based on thorough patient assessment followed by patient-tailored therapies, which include but are not limited to exercise training, education, and behavior change, designed to improve the physical and emotional condition of people with chronic respiratory disease and to promote the long-term adherence to health enhancing behaviors. Traditionally provided to stable patient with moderate to severe chronic obstructive pulmonary disease, recent studies have shown that rehabilitation in the pre-exacerbation period can reduce hospital admissions, effective with equivalent benefits in patients with non-COPD respiratory disease, and refer any patient with functional status limitation or persistent respiratory symptoms despite otherwise optimal therapy. For shoulder rehabilitation, shoulder disorder more common in older men than older women and contribute to disability and impact the quality of life. Because of the limitation, especially if the dominant extremity is involved, older adults will have difficulties with acute daily living activities such as putting a coat or combing hair and other activities involving reaching overhead. Conservative non-operative medical management is preferred approach for shoulder rehabilitation, with a referral to outpatient occupational and/or physical therapy to decrease pain and improve the function. Functional use of the involved extremity may be determined using the standardized self-assessment, such as disability of the arm, shoulder, and head outcome measure, which measures the change in symptoms and function throughout the recovery process. Therapeutic exercise aims to gradually increase passive range of motion of the shoulder and strengthen the elbow, wrist, and hand. Shoulder exercises should progress to active range of motion and isometric exercises as the patient recovers. Rehabilitation services are discontinued when the patient has returned to completing daily activities, has pain-free active motion, and has maximized muscle strength. Mobility aids, orthotics, adaptive methods, and environmental modifications. Estimated 6.8 million Americans use assistive technology devices to enhance mobility. Important to obtain physical or occupational therapy evaluation early in the hospitalization to assess for equipment needs, including mobility aids and adaptive equipments. Early assessment is critical to providing older adults with the correct equipment and to maximize their independent functioning. Important to identify the underlying cause of disability before prescribing a device or modification. Medical or surgical treatment for individual diseases and impairments may be more effective or may enhance the usefulness of these approaches. The first mobility aid here is cane. Cane supports 15 to 20% of body weight, used in hand contralateral to the affected limb. Degree of support increased with increased number of tips, but it can become heavier and more awkward to use. Proper length is important for the stability, and there is a certain way to measure to determine the length. Is by measuring the distance from the distal wrist crease to the ground as the patient stands erect, and from the greater trochanter to the ground. There is also straight or quad cane. They provide unilateral support, assist with balance, reduce weight bearing on the opposite leg, and they have small or large base quad canes are available. There are also crutches. There are auxiliary or forearm crutches used to provide bilateral support. Auxiliary crutches are seldom recommended for older adults because greater arm strength and coordination are required for use, and risk for brachial plexus injury if used incorrectly or if it didn't fit correctly. Forearm crutches are more functional because a cuff secures the crutch on the arm, allowing use of the hand. There are also walkers. They can completely support one lower extremity, but not full body weight. It should be adjusted so that the user maintain an erect posture and does not lean forward to reach the walker. There is also a pickup walker that requires strength and cognitive ability to learn necessary coordination. Wheeled walkers, they allow smoother and more coordinated, faster gait, more likely to be used correctly by people with cognitive impairments. This is the stationary pickup walker. It provides bilateral support, must be lifted and advanced, and requires strength and coordination. Very stable and allows non-weight bearing movements. There is the rolling or rotator walker. It is less stable than the stationary walker, but easier to advance. It allows for smoother, faster gait. Rotator requires more coordination because of the brakes and safety awareness. Roller are good for outside walking because of the large wheels. There are also wheelchairs. They're required for patients who cannot safely use and or unable to ambulate with other mobility aids, must be fitted according to the patient body build, weight, disability, and the prognosis, because incorrectly fit wheelchair can result in poor posture, joint deformity, reduced mobility, pressure ulcer, circulation compromise, and discomfort. The Rehabilitation, Engineering, and Assistive Technology Society of the North American Wheelchair Service Guide provide detailed information for determining the most appropriate wheelchair for each patient. We have also scooters that are required for patients who cannot safely use or are unable to ambulate with other mobility aids. Their motorized wheelchair may be used by mentally alert people with bilateral arm weakness or other neurological disorder that limit the use of arm, or severe cardiopulmonary disease who lack the endurance to push a wheelchair. Motorized scooter offer less trunk support than a motorized wheelchair, but are more acceptable to some people. Use increases mobility, but there is a risk of conditioning because patient might otherwise push a wheelchair or ambulate. Orthotics, exoskeleton designed to assist resist, align, and stimulate function. They are named by the use of letter for each joint involved. For example, an AFO is an ankle and foot orthotic device used to support weak pretibial muscles. May also benefit patients with spasticity. Adaptations to facilitate dressing may be necessary for older adults with problems such as range of motion loss, decreased strength in coordination, and limited endurance. Adaptation include shirts and fit over the head or fasten in the front and allow freedom of movement, hooks and loops, Velcro fasteners or button hooks with customized grips, long loose socks, long-handled shoehorn, and elastic shoelaces that need not be united. Environmental modifications can have a major impact on the older adult's ability to function independently or with minimal assistance at home. Environmental modification include assistive devices such as reachers, door knob extensors, special utensils and adapted telephones, grab bars, installers near toilet and top shower, raised toilet seat and bathtub benches, long-handled bath brushes, handheld shower faucet, and soap-on rope. So in summary, for this session, the WHO model for rehabilitation considers the interaction of body functions and structures, health conditions, activities, and participation, and environmental and personal factors. For an inpatient rehabilitation hospital to be Medicare certified, a certain percentage of patients must have at least one of 13 conditions and receive 3 hours of therapy 5 days per week. The patient and family are core members in the rehabilitation team. Many of comorbidities that would otherwise interrupt or delay rehabilitation can be prevented or managed. Optimal rehabilitation outcomes depend on comprehensive assessment of the patient, coordinated interprofessional management, multifaceted interventions, and access to appropriate and high-quality care. Mobility aids, adaptive devices, orthotics, and environmental modification can be used to increase the function and quality of life of patients. This is the end of my presentation. Do you have any questions? Yes, thank you very much, guys.
Thank you, Dr. Ladin, for the informative presentation. Do you want to add anything, Dr. Nadia?
No, thank you so much.
Okay, so moving on to the third presentation, it will be how to make side-by-side bar chart in Excel, and it will be presented by Dr. Mahnoor. So if you are ready, you can share your screen.
Hi, everyone. Yes, I'll be explaining how to make side-by-side bar charts in Excel. For that, I'll have to show you my screen. I'll just press this. Just 1 second. I'm having a little difficulty showing my screen. Wait, I think I did it.
You get it?
Can you see?
Yeah, we can see.
Okay, great.
Okay.
So I went ahead and opened an Excel sheet first. Can you guys see that?
Yes, we can.
All right, great. So basically the side-by-side chart begins with having some data. So I looked at quite a few videos, and this data chart was the easiest to explain. So basically we started with dog and the breed of the dog and the days it took for them to adapt to like a new home. I kind of just made this up myself. It wasn't exactly the same. So here we have like a data set of almost, wait, let me just complete this. So here we have a data set of starting from A1 going on till C34. So this is important because you need this information to actually begin to make your bar chart. There's two ways. The way that I do it is basically go from here to the insert table and select a pivot table. This is easier because it tells you what data you're working with. So when you do this, it kind of automatically populates the range. So you go from, it's showing A1 and it's going till C34. So this is accurate. We are happy with this. The important thing is do not insert to a new sheet. You need to be inserting it obviously to the sheet that you're working on. So you, I'm sorry, you'll press existing sheet and then you can press wherever you want to see it. So I want to see it next to my information. So I can press right here, E5, and it'll say, is E5 okay? And I'll say yes. And then I'll just confirm that the C34 is accurate and the A1 is accurate, and I'll say create. So here, this makes the pivot table. So what I want to do is in the rows, I want to add the dog breed. So it's going to give you options. Okay, so you can select whatever you want as rows. I can select any of this data as a row, but I want to do the breed. And I'm also wanting to show you, so it's already auto-populating to put it in a alphabetical order. You can change it to descending, you can change it to ascending, and the sorting by breed. Then in the column, since what we want to see is how long it takes them to adapt, I'm going to put days to adapt. So here it's done that. Okay, so 5 to 10, 10 to 15, 15 to 20. Now, next is the values. This is a little confusing because I put the value as dog, and that's why it's auto doing it as a sum. We don't want it as a sum. We want it as the number of dogs. So you just change it to count and it'll show you. So there's 2 Chihuahuas that took 5 to 10 days to adapt, and we can confirm that here. So there's one right there and there's one right there. So it's accurate. If there's any point that I can slow down and explain, please let me know. I'll do that. Is it okay for now?
Yeah.
All right, great. So just a few things that you can do with this information that are interesting is that, so we're doing summarized by count, and then you can also change it into percentages. So you can do percentage of row, which will show you according to the rows, but I think it would be interesting to do it by column, and that'll show you, so you have 40% of Chihuahuas that will be adapting in 5 to 10, 40% of fuzzy dogs, and retrievers only 20%. So you can just, whatever information, however you want it to be presented, If you don't want to see the total percentages, you can just do default, which is the numbers, and that'll give you whatever information you want. So I'll do it with percentage of column. Now, the next thing that you do is you go to insert again.
Excuse me, Mahnoor.
Sorry. Yes.
I just want to confirm that if you choose the percentage of column, this
Yes.
will be like 40% of the total dogs are
Available
Chihuahua, right?
here? No, right
Yes.
now this is showing you like in the 5 to 10, only in the 5 to 10 category, how many there are.
Okay.
5 to 10
Okay.
days. Yeah, so it's under every day, right? That's why I did a percentage of column. So it's showing me that in the 5 to 10 days, number of days, only for like 40% of the Chihuahuas have this 5 to 10 days.
Okay.
So that's it's basically sorting according to the days, not according to the breed.
Yes. Yes. Okay.
Is that
Thank you. Yeah.
Okay.
I get it.
Great. So in the insert, I'm sorry, I have some, you do chart and, oh wait, hold on. I need to read this. So here we have the pivot table, and then you can just press chart and it'll make it in a chart form. Oh God, I don't know where I went. There we go. Here we go. And then you can put it under the column to see how you want to see it. The interesting thing is that the colors are pretty intense, so you can just change it. So this is, okay, yeah, another thing. This is the stacked style of charts. If we want to do side by side, you just go to setup and you go to chart type, and you can do it this way, or you can do it this way. You can do it whatever way you want to do it. You can even make pie charts or these stacked area charts or whatever. So we want to do side by side, so we'll just do the column chart. And now you can see that it's showing you in a really good way all the percentages of each breed and how many days they're taking to adapt. Can I show this again, or is that okay?
It's okay, I guess. Thank you.
Okay, so and then another cool thing that you can do is that you can just change the colors, or you can customize the whole thing if it doesn't kind of fit with your theme. You can just change the background color to white. You can change the border colors to whatever you want. And then you can also, like, these are all the options for what you can change. So this grand total, if I didn't like the color of this, I can just change it to whatever I want. But other than that, it's pretty customizable, depends on what you want to see it as. And that's it, it's pretty simple.
If there is any one like more recommended, or it way like when you put it in a paper, it's like better than the others?
I'm sorry?
Or if there is any type of chart, yeah, we can go different, we can do different type, right? If there is one recommended basically for most papers, or it makes no difference to choose whatever you want?
No, I think it just depends on how you want to show the data.
Okay.
It like depends on the research you're doing, and depends on like how you want to portray it and how you want to make it simpler. This is the one that we wanted to do, the side by side, and I can just change it whenever I want to pie chart to anything. And that's it.
Thank you, Dr. Mahnoor. But there is another question. If we have like more than one chart in the paper that we are presenting, do we like do only one type side by side, or we can do side by side and pie chart and another one we can change in different?
Sorry, you can do more. The only thing is that if you're doing it through the pivot chart, you need to kind of do the pivot chart and then do insert chart, because obviously you'll need to have all of that information put in. You'll have to tell it where you're getting that information. If you're putting multiple informations in the same Excel sheet, it doesn't know where you want to pull that from. So you have to specify, like I did before when I made the pivot table. I said I wanted it from A1 to C like 34. So it helped me do this information.
Mhm.
So that's why the chart is of this information.
Okay,
But
thank
if you
you.
wanted to add some other information, you would probably have to figure out how to put it in another section and then make it from there.
Thank you.
Okay. Thank you. All right, that'll be all.
Thank you so much. It was nice.
Thank
Um,
If I went too fast, if there's anything I can clarify, please let me know. I can just explain.
yeah, if anyone else have any question, you can go ahead. If not, we can move on to the next presentation. It will be project management,
Thank
the
you.
basic tools. Thank you so much, Dr. Mahnoor. The project management, the basic and tools, it will be presented by Dr. Amel and Dr. Salma. So if you are ready, you can share your screen.
Thank you so much. Good afternoon, everyone. It is a beautiful, beautiful day here in California. It's rainy and it's really nice weather. Thanks, Dr. Nadir and Dr. Astad and all the team leaders for your help all through this journey. And my name is Amel Salah or Amel Omar. Me and myself and Dr. Salma will present project management, the basics and tools. So is my, I just shared my screen. Is it clear?
Yeah, we can see it.
Thank you so much. So I will try to do like a slideshow, but I can't move this thing. Sorry. Okay, perfect. I can do it. Is it okay to do it like that?
You can choose from beginning
Uh-huh.
on the left top.
Oh, right. Or from here, right? Yes. So is it clear now for you guys?
Yeah, we can see it.
And it's moving on and back and forth, right?
Huh?
Yeah. Okay. So speaking about, sorry.
I think you are on different page because we
Oh,
are
really?
two. And it was
so now it should show like basic of project management. Are you seeing this one?
Yes.
And the one next is what is project management? Is it moving or fixed on that page?
No.
So I think
you need to unshare and then share.
Okay, unshare and then make like a slideshow, or I can just do it like this. What do you think? Okay, I'll try and share. Sorry for this. Okay. New. So I have to do stop share or pause share or what?
Stop share.
Stop share. Okay, and then
Screen that the demo or the.
But it will show the same thing, I guess, right?
Or share the whole window instead of the.
Oh, okay, got it. Okay. So share. It doesn't look anyway.
Okay. Share the screen to share a window option to share an app or a tab or something like that. Share the screen.
It gives me like Microsoft PowerPoint share and share a screen, which is, if I share it, I think I will share only this one. So now is it working?
Yes.
Okay, finally. So The presentation today is about the project management, and just to either subject for you guys, I encourage you all to think about the project in your mind, because I do believe that all of you are practicing project management, if not every moment, that will be every day. For those considering this cycle for residencies, they can think about their journey as a project from like starting, thinking about doing the USMLE till they get match. So that I think will make the presentation more easier for you. So first, we can speak about what we can define firstly, what is a project? So as I mentioned, a project is a series of a task that need to be completed to reach a desired outcome with a collaboration and careful planning to keep the project on track and importantly on budget. So project definitely should have like a definite goal and interrelated and dependent activities and tasks. Importantly, it has a finite duration and it provides a unique product in terms of service or information and consume resources. It operates under scope, quality, cost and time constraint, and utilizes teams. It's based on personal integrity and trust. If I'm going fast, please let me know, okay? So what is the project management? Project management is the application of knowledge, skills, tools, and technique to meet the project requirement and achieve the desired outcome. You put an outcome in your mind, you're gonna achieve that one. So in that process, to be managing the project, probably you need to do like application of all these knowledge and skills. So the definition of project management is the process of steering a project from the start through its life cycle. The main objective of the management is to complete a project within established goals of time, budget, and quality. A project management life cycle starts when the project is initiated and ends when the project is either completed or terminated. So at the end of each phase, there is a decision point where a stakeholder decide whether or not to complete the project or terminate it and cut losses. So it is a kind of cycle. When you go from a step to another, you look on what you achieved and you evaluate. So let us speak about the history of the project management. So the history of the project management is very old. It's from the invention of the wheel to the construction of the Giza pyramid to the development of the device you are reading this on. The practice became more refined in the last 100 years, with methodologies being developed, starting with Frederick Tyler, the principle of the scientific management in 1911. Then came Henry Gantt and introduced the eponymous Gantt chart in 1917. After that, Toyota implemented the rudimentary from Kanban and Lean in their manufacture unit in 1950s. Then after the Project Management Institute formed in 1969. So over the years, as the nature of the market changed, newer methodology like Agile were introduced that refined the project management process further. So why we do project management? What is the importance of project management? Project management is a way to get organizational energy and effort to flow horizontally toward the customer and across the departmental barrier. So it's kind of like a tool that helps you achieve your goals in more fluent and easy way. And this is because project management is recognized as a core competence, and it is a discipline in a disarray. So project management differs in significant ways from ordinary management. So let us speak about criteria for success of a project management. So there are very important 3 criteria, which is completion on time, completion with budget, and completion with full functionality. What are the values and advantage of project management? Apart from stimulating productivity, improving project transparency, and providing a clear vision to the team, project management can bring the following advantage. First, effective communication. Second, effective resource management, which is really important, right? We need to manage our resources. Sometimes we work with a very limited resources. And thirdly, improve customer satisfaction and relation, which is the goals that we aim to mostly. And flexibility and higher risk tolerance. We're going to see later the importance of this. And improve team morale, help the team members to understand their responsibilities, deliverables, expected, and the schedule everyone needs to follow to complete the project on time and within budget. Higher quality of the output and improve productivity, and importantly, the retrospective learning. So, what are the areas of project management? The Project Management Institute has identified 9 areas of knowledge within project management, which used to manage our project from start to finish. The 9 areas are integration, scope, time, cost, quality, human resources, communication, risk procurement, and stakeholder. So, speaking about the life cycle, a life cycle defines the beginning and end of a project, representing all the phases together. When defining the project life cycle, the first phase is noted as step 0. It usually captures the visioning and conceptualizing of the project. When you think about a project, when you put the concept in your mind and the vision, that is step 0. According to the Project Management Institute, most life cycles have kind of 4 to 5 phases, but sometimes it might have more. So what are the phases? It is initiation, planning, execution, monitoring, and closing. So let us start with initiation. The initiation of the project life cycle is the invitation, often considered the most important stage. The project initiation phase includes all the preliminary work that must be done before any other project activity can take place. The essential element can be roughly divided into 4 categories, which are building a project case, then conducting feasibility report. Number 3 is involving stakeholders, and 4, creating a project invitation document or project chart. So what is the output of the step 1? The output of step 1 include required stakeholder approval to proceed to the next phase, which is phase 2, which is the planning. In this stage, we should do the planning details of the project and create a successful project plan. The details can be divided into 4 categories. To have a successful project plan, you have to have a scope, resources, time, and communication. So the output for step 2 include a detailed plan, a project communication plan, budget baseline, project scheduling, individual project goals, document, and updated stakeholder registry. Moving to step 3, execution, which is the biggest stage of the project. It usually starts with a kickoff meeting. Project team members are coordinated and guided through a proper project communication for project execution according to the approved project management plan. Decision and action are implemented, and it is important to keep a log of issues and to make update of budget and other planning document. So what is the outcome here? Is working towards solution development. So moving to monitoring and control project life cycle. The importance here are time, cost, performance of the project are compared at every stage whenever you finish in a stage or you are going on that stage, you need to compare the time, cost, and performance. Necessary adjustments are made because it is not kind of something rigid. Sometimes you need to do some adjustment to move forward. So you can do adjustment to activities, resources, and plan to keep things on the right track. So output here from this phase include project progress reports. So step 5 is the closure of the project life cycle. This process of finalizing the project, reviewing and delivering the project to the customer, submitting the final reports. Project should only be considered closed when all stakeholders are satisfied with the successful completion of the project objective. Team members and other resources are released for work on other project. You are done. Then you're gonna move to another project, right? So the output here include approved project result and learning that can be applied to similar project in the future. So it is a continuing learning journey too. So let us speak about the popular project management approach. The project management approach offers a collection of process, methods, and tools to manage and accomplish project activity. They ensure consistency, simplify complexities, lower cost, and reduce risk. There are a number of well-established project management approach available. So examples: phased approach in project management, lean project management, iterative and incremental project management, the critical chain, the product-based planning, process-based management, or project production management. So sometimes things doesn't go well, right? And project might fail. So let us know the main reason of the project failure so anyone can address to mitigate it and know to avoid it. So as I said, every project is prone to failure due to one of the 5 reasons listed below. First, resources deficiency, or insufficiency to complete the project. Second, inadequate time frame, having trouble completing the project on time. Number 3 is unclear goals. Lack of detailed documentation can lead to inappropriate result. Number 4 is poorly management stakeholder expectations. Project scope change that are not agreed upon by stakeholder, causing varying views of quality time or budget. And finally, inadequate risk management, failing to establish the risk associated with each project can cause the project to fail. So these 5 reasons for project failure, everyone should mitigate whenever they are managing a project. So let us speak about team building and communication. The size and role of the team depends upon the project need. Team member may fulfill one role or more. Project management communication process to ensure effective communication among relevant teams and stakeholders. It includes project collaboration tool to share document and feedback and to keep track of the status. Key factors in project management communication includes objective, message, audience, and channels. There are 3 steps in the project management communication process, which include planning communication, managing communication, and monitoring communication. An effective communication process is critical to a project success. So creating a project management system in which all team members can access all relevant information about a project easily and efficiently is a team building and transparency, which is important to build trust and to keep work on track and to improve team productivity. So how to improve project transparency? First, by let everyone see the big picture. Second, let everyone see the data. And third, make collaborative easy Number 4 is share calendars, and 5, regular team meeting, and finally choosing the right management tool. So the key to project success include team collaboration. Steps to ensure effective collaboration include improve communication within the team, be as transparent as possible, get everyone involved, encourage members who take the initiative, remove physical barriers, optimizing office meeting, use project collaboration tools, and keep the team happy and motivated. So speaking about the methodology and framework, project management methodology offers clear project roadmap that lists all steps required to deliver a project successfully. The project management framework provides structure and direction to a project. However, unlike project management methodology, it is neither too detailed nor too rigid. So here is a comparison between the framework and methodology. So methodology offers rigid rules and practice for completing a project, while framework gives an overview of how guidelines can be implemented. So methodology is a rigid, and framework offers space for creative adaptation. Methodology preferred by beginners, while framework preferred by experts. And methodology include all performance guidelines in granular details, and framework hard to develop and implement performance metrics. With methodology, or a methodology cannot embed it with other practices and tools, while framework leave room to include other tools and practice. And traditional project management, PMBOK, is a framework, and Prince2 is a well-known project methodology, project management methodology. So what are the key project management skills and competencies to master in 2023? First, leadership skills. Second, effective communication. Third, planning and strategic thinking. Team management, time management, task management, risk mitigation, expert negotiation skills, critical thinking, all while using the right tools. So thank you for listening. If you have any comment or any question, maybe we can do it after Dr. Salma presentation, or now if you prefer. What do you think?
I think Dr. Salma can continue her presentation, and if there is any question, we can leave it to the last.
Okay, thank you, Salma. I can do the slide for you if you prefer, or you want to share your screen. What do you prefer?
I can share my screen if you don't mind, Amelia.
Yeah,
thank you.
Thank you.
Can you hear me? Can you hear me clearly?
Yes, we can hear you.
Yeah. Hello, everyone, and thank you, Dr. Amel, for this great presentation. Thank you, Dr. Ajad and Dr. Nader, for giving us this opportunity. So I will try to share my screen now. Can you see it?
Yes.
Mm-hmm. So to do a slide from where? Remote control.
In the toolbar to your left.
Okay.
Yeah. It's down a little bit.
Mm-hmm. In the draw, this one?
Yeah, the new slideshow.
Okay.
No, it's my fault. On the top slideshow.
Yes.
Go to the right. Go to the right.
Just if I can remove this one from me. Okay. Here.
A little bit to the right, you see the slideshow.
Yes, because
after animation.
Yes, yes, I can see it now.
Yeah.
Okay. From beginning. Okay, I will start then. Okay, so I will start from here. Dr. Amel talked about the project management basics. So I will talk more about the tools for that. Project management for researchers is very important because it can help reduce wasted effort, track progress, and respond quickly to deviations from important aims while keeping creativity intact. And these factors can help researchers work smarter with available resources and better compete for funding by demonstrating a positive track record of project success. The project manager executes the project in accordance with the project specification, and the progress is being reported to the project steering group by using progress reports. Each report provides a review of research content and resources situation. And this process of managing an academic research project actually is considered very challenging, especially for those who are new to research. And this process includes first tracking multiple deadlines and tasks, secondly, communicating with team members, thirdly, tracking the comments from professor, peer researchers, or vendors, and thirdly, managing complex paperwork and data, and finally, keeping on top of changing and revisions. So now I will talk about the tools. The good tools to consider good have to be first cost effective, because most of researchers are students, so that's a very important thing. And secondly, should be easy to use for everyone. And thirdly, should be have good features. And fourthly, collaborating, and finally, should be also compatible. So there is different kinds of tool for researchers, which include journals for topics. So we can search for topics from journals, and we can also, there is data collection tools, which I will talk more about it. And plagiarism checkers also important. There is multiple softwares can check for any plagiarism, and also project management softwares, which is very important for organizing the project management. About the data collections, we can do data collection through interviews, doing interviews, going to the libraries and search, and also surveys and questionnaires, case studies, focus groups, and through observation, and also taking photos and videos. Or this can help with data collection. And about the plagiarism checkers, there is multiple softwares available for that, including Trinka, Turnitin, WChecker, Witext, Copyscape, and Grammarly, which is, I think most of the people know it, and CopyLeaks also. And these also some of the project management software available for research, including like Asana, Trello, and Jira. Jira, this is can be free for 10 users, and Wunderlist, ClickUp, CodeBox, WorkZone, Baymo, Workday, and Evernote. And also there is Rike, ProofHub, Zoho Projects, and Gantt Pro, which is can be free, like giving like a 14-day trial, free subscription. And also there is Pro Workflow, Airtable, Team Gantt, and Caseflow Project, and Basecamp. Those software can help in the research for project management. So now we will talk about the pros and cons of some of these softwares, which is called also project management online platforms. First, the Basecamp. The pros of Basecamp, it offers an intuitive suite of tools at a minimal cost. And also Basecamp facilitates collaboration between research team members with features such as to-do list, messaging, file sharing, assignment of tasks, milestones, due dates, and time tracking. And the cons of it, it's need like $20 per month for subscription, and it's only free for teachers. And about Trello, the advantage of it can help manage research project by keeping everyone on time and on task. And it uses a distinct interface based on cards and lists, and may be especially useful for smaller projects. But the cons of it, it's not always the best tools for complex projects. And about Open Project, the pros is it has tools to create dashboards, Gantt charts, budget, and status reports. And activities can be assigned to team members and progress monitored. Open Project also has a tool for agile project management. And disadvantage of it, it's while the software is free, Open Project must be installed and maintained on a local server, and there will be probably cost associated with this, so you can't install by yourself. And for Proof Hub, it's the pros of it is ready-to-use project template and used for task management, time tracking, and project reporting, team collaboration, like using for chat, notes, and discussion, and also can help in file management and online proofing. And the cons for it, it's only give like a 14-day free trial with all features. After that, you need to pay for subscription. And ClickUp, the pros of it, it's one of the best project management software for search, actually, for research. And it's great choice for both individual researchers and research teams. And it is cost-effective, cross-platform, and easy to use. And it organizes your research task into lists and then drags and drops them to create a workflow that best suits your needs. It adds comment and attachment to your tasks to keep track of all the relevant information related to your projects. And the cause of it, it's ClickUp actually does not allow users to create folders. And some users have complained that the user interface is not very user-friendly. And about Thrive, it's a cloud-based project management tool that helps team manage projects from start to finish, and also offers a variety of features such as task management, file sharing, time tracking, and reporting, like most of the softwares. And plus, it is easy to use and can be accessed from anywhere. This makes it a great choice for researchers who need a tool that's both versatile and easy to use. But the cons of it, lack of note-taking tool. And about Zoho, it's a very cost-effective tool, and it is one of the cheapest project management software available in the market. It's also a cross-platform tool, and the user interface of Zoho project is straightforward to use. But only they have a disadvantage of poor customer support. And Evernote actually is a cross-platform note tracking application that help you organize your life. And with Evernote, you can tag notes, capture ideas, and track tasks. And the best part about Evernote is that it is available in various devices, including you can download it in desktops and mobile devices also. And Evernote groups your notes into notebooks, which are similar to file folders. And it's meant to be used as a note-taking tool. So you can use it to jot down ideas or things you notice with a text, camera, or even voice note. And the cons of it, some features are not available on free accounts, and it can be slow to load on all the devices, and it can set tasks and deadlines, but not weekly reports on who did what. Finally, it can be challenging to collaborate with others on a research project. And bit.ai, it allows researchers and team to collaborate, share, track, and manage all knowledge and research in one place. And consider one of the easy-to-use software with minimum editor that support Markdown. And it helps also a collaborative real-time editing and communication with peers. Add any type of digital content like images, videos, etc. to your bit document. A content library also. It contains like a content library to save all your media files for quick access. And smart search allows anyone to search and find any files, image, links quickly. So it's considered one of the best software for project management research. And Asana, it can be tailored to meet the demands of a wide range of academic research projects. Also, Asana was created so that any size team can track their progress and address their research-related issues in one location, eliminating the need for endless meeting, email updates, and notes. And the cons of it, it can be challenging for teams with more complex workflows, and it can be difficult to track tasks when there are a large number of collaborators. It's best suited for teams who will be working closely together. And that's the end of my presentation. I hope it was useful for you guys. Do you have any question?
Yeah, any question for Dr. Amel or Dr. Salma? Thank you both for the great presentation. If you want to add anything, Dr. Nader?
I'd like to thank all the presenters today. These are great presentations. Thank you. So I just want to continue with what Amel and the person mentioned about the project management. So if I want to share with you, where is it? Let me share the screen. So one thing we can use, for example, in Glide apps, they have a template section where you can look at the templates. One of the templates is made for like project management. So if you click here, this is just a template for you guys if you want to use it. Basically, it has different projects, and every project of this has some team members and the leader of that project, and then the due date and so forth. So I'm going to show you how it's done. So if you click on preview, it has a home where you will have the home page, but the categories, so it has different categories for the projects. Let's say if you have one project, you're going to start with the idea. So you can say, we want to start with a project that we want to write a poster about the topic. So your topic will be the title for the project. So I'm going to change this to, let's talk about poster number 1, Alzheimer's dementia in nursing home, for example. So you submit. So this will be the poster or the project about we are working on this. And then you want to add team members in this. So the users, you're going to add them. as far as adding this to the project. And then when you add, you can change, let's say it's in progress. So every team member will be assigned a task and then complete that task. And then they will update the team leader. And after you're done with all, it will be in the completed section. So you can change the status of the project from one place to another. This is one way of doing project management in collaboration. You can use different online tools, as Dr. Salma mentioned. Some of them are free, some of them are paid options. So here we want just to have an idea about how we can deal with projects. And as Dr. Amel mentioned, you are going to apply for residency, for example, or the dentist will apply to similar program. So you want to work on building your resume, improving your CV, and also during ERAS application, you want to target certain programs. You want to do interviews, for example. You're gonna arrange or schedule if you want to go in person, where the hotel and so forth, how much it costs. All this will be like projects in your life. So you need to know how to manage this in your life. If you need help, you want to get letter of recommendation. So you need it by certain date. So you want to approach the letter writer in advance so they can have some time to write you the letter and so forth. So, but for us here in the fellowship, I want you to think about your own projects, posters, manuscripts in research, and build the team, identify the team leader, and then assign the task and set some timeline goals. And if you are applying that to a meeting, for example, they have a deadline to submit your abstract. So you need to finish all the data collection and analysis and write the abstract and submit before the due date. And hopefully it will be accepted. After it's been accepted, then you're gonna work on who's gonna present and who is gonna develop the template for the poster and complete the poster. And then you work on presenting and improving your presentation. Sometimes you need to present that in a video format, or some of you will go in person. So whoever is going to present in person or on a video, I'll encourage you to practice that within the team. So you practice within the team of that project and see if there is any feedback. Again, also with a poster, see if there is any feedback before you print the poster and take it to the conference, for example. If you are writing a paper, it's going to be a teamwork. So you're going to divide the task between the team members. So a couple of members will work on the introduction, a couple will work on the body, and so forth. And then also try to use a deadline so that you can finish within 3 weeks, for example. We're going to have the first draft, then review that, another 3 weeks to revise that, and then submit, for example. See if there is any chance for acceptance and so forth. So it's a process that you need to know how to do it. It's a skill that you want to develop, and you can talk about it and you can practice it. And hopefully when you join residency, you're going to be ready to tackle any task, any projects in the future, hopefully. Thank you. Any other questions?
Thank you, Dr. Nadir. Right now, if anyone has any update about their project, you can go ahead.
Yes, My name is Dr. Mohammed Osman. I am conducting a systematic review with my team about the use of AED in out-of-patient cardiac arrest. We're progressing. We're expecting to finish by the 10th of September. And and that's it. Yeah.
Excellent.
Thank
Thanks for sharing and good luck. Do
you.
you expect that to be submitted as abstract or manuscript?
A manuscript.
Nice. Okay.
Thank you.
Yeah.
I have one question, Dr. Nader. You've previously sent us email telling us to request how to request the LOR. I already requested mine and you uploaded it. Do I need to request again? If you, do you need to like mentioning it that I've conducted this research, or it doesn't matter?
In general, I would mention that you are involved in different projects, and then if you want me to update that with a specific project, let me know so that I can modify the letter with some detailed
okay
about the project. So when you are done, let me know. Send me the project title and where you're gonna submit and so forth.
Okay, thank you, Dr. Nader.
You're welcome. Excellent. Thanks for sharing on the update. Anyone else?
Assalamu alaikum, Dr. Nader. How are you?
Alaikum assalam wa rahmah. Very good. How are you, Dr. Ryan?
Alhamdulillah, I'm good. I just wanted to update you. So we had previously spoke about the webinar regarding long COVID and focusing on cardiopulmonary, neurocognitive, and musculoskeletal symptoms of it. So me and my team have been working really hard, alhamdulillah. We've been able to do some research, and we've started already preparing that. Inshallah, we're hoping to put out a flyer this week and present it mid-September.
Sounds good. So perfect. Next week, we will have a seminar about elder abuse.
Okay.
Perhaps the week after, if you want it during it, or you want it some other days. What your idea?
So I'm hoping to have the webinar because we want as much people to join. I was thinking we don't want to take away from the Saturday meeting, so it's most likely going to be on a Sunday around 11. We're also going to be reaching out to doctors within who specialize within those three fields, just to kind of give us their personal experience about patients with long COVID and what they've assessed in their practice. And then as well, if any of the participants have any questions, if we're not able to necessarily answer them, we will have those specialists on hand. And it would be an honor if you could be one of the panel doctors with us. That would be great as well. So I'll reach out to you, inshallah, with more details. But so far, alhamdulillah, it's going well.
Sounds good. Thank you so much. This is great.
Thank you, Dr. Nader.
Good luck. Yes. Thanks for the update. Anyone else? No, go ahead.
Hi, how are you? Just have a question here. Some new fellows asking me about the ERAS application. Before we had examples of TV and personal statements in the app. So can just you show them what is it, and so they can benefit from it.
Oh, sure. Okay. I'm going to share it again with chat, but
okay, that's fine.
I'm going to share it also on the screen. So what you go to this website, erasdocs.glideapp.io, and then you log in, and it will have different documents from previous fellows who matched in the past few years. So they shared their application, a copy of that, and they shared their personal statement. So you click on personal statement, you can see all of them, or you can select any one of these sample. Then just click on it. It will have the both the step, the ERAS application. You look at that and see how they answered questions, how they portray themselves in their story as far as a personal statement.
Yeah, perfect. Can you just share a link in the chat, please, for them?
I did. Didn't get it?
Yes. Okay, that's perfect. So also one more thing about writing the application. Do we need to change like the content, like the experiences and the way we wrote it in the last year? So we have to change it totally, or it's good to just modify some few things?
I think you need to modify just a few things. You don't have to change things. You just add whatever happened and update. It's just the application that from last year, right?
Yes.
Yeah.
Okay. Thank you,
So,
Dr. Nader. That's so helpful.
no problem. Thank you and good luck. Wishing you all the best.
Cool. Thank you so much.
Any other questions, updates, or ideas? How is the app development going? If there are any teams?
Hello, Dr. Nader. How are you?
Very good.
Alhamdulillah. So I wanted to update you on our application. So Google Play updated their policies. They no longer accept applications that don't support Android 13. I think this is the latest version. Unfortunately, Codular supports Android up to, I think, maybe 31. The 31 API, which is correlated with Android 11. It doesn't support Android 13. So we were not able to upload the file to Google Play. It was the last step in the uploading our application to Play Store. So we stuck on this step. So we now have two solutions. The first one is to ask a programmer to change the code of the file itself to be able to to be accepted to the Play Store. And the other thing, which is the difficult way, is to rebuild the application in MIT App Inventor, because MIT App Inventor constantly updates their platform in accordance with Play Store. So the latest update was 2 days ago. They updated the entire platform, but Codular, unfortunately, they don't update their platform. So I was able to reach out to a programmer and he promised to help. But if he couldn't do anything, I think we have to rebuild the application using MIT App Inventor.
I think you can convert it. I think both MIT and Codular work the same. If you convert it to the file AIA or what the format, and you can just bring it to MIT, if I'm not mistaken.
So I think, yeah, it's updated on MIT App Inventor, but Codular did not update. I even sent a message.
Your app, your mobile app, if you convert it into, I think, let me see. Can you upload it to download it as AIA file and then upload it to MIT App Inventor?
I did not try this, but I'll try it. I'm not sure if it's gonna work.
I'm not sure, but I think they work the same, if I'm not mistaken. It's like Google and Excel. If you download document from Google Sheet, for example, you can export it or download it as XLS file, and then from Microsoft Excel, you can open it, or vice versa. You can save the file from Excel and then upload it to Google Drive and convert it to Google Sheet. I think that would work, but I haven't done it. So
Yeah, so I will try. It would be great if it works.
the concept is the same, but I'm not sure. I haven't tried. So good luck.
Thank you so much, Dr. Nader.
Excellent. Good luck. Any other updates?
Yes, Dr. Nader, and me and Dr. Sama and Dr. Shada and the team are working on medication adherence in elder people. So we're doing systematic review. It's going on. We just hope we'll do it before end of September. We're hoping that.
Excellent. You are submitting as a manuscript or as an abstract?
Abstract.
Abstract. Excellent. Excellent.
Thank
Good
you.
luck. Let me know if I can be of help.
Sure. We need you all the time. Thank you so much.
Thank you. So any other questions, ideas, or comments or updates? If not, thank you so much again, all the presenters, the moderator, and the attendee from today's meeting, and those who will come later. Thank you, Dr. Rawia.
Thank you, Dr. Nader.
Any other comments?
No, I just want to thank the presenters. They were great presentation from you. Thank you all. Thank you, Dr. Nader. Thank you for the attending fellows, and see you next week. Inshallah.
Inshallah. Assalamu alaikum.
Wa alaikum assalam.
Salam. Thank you, Dr. Nader.
Thank you. Thank you all.
Assalamu alaikum, Dr. Nader.
Assalamu alaikum. Thank you.
I have a question, Dr. Nader, please.
Yes.
I sent a request for LOR in around 10 days, but it hasn't uploaded up to now.
This is Nusayba.
Yes, doctor.
All right. I have several requests. I haven't.
Okay, doctor. Thank you so much.
Sure. Yeah, no problem. Go ahead, Dr. Amel.
So Dr. Nader, my friend asked me if she can join this fellowship, if there is any chance that she can join in before the application starts. I mean, within the next month.
Sure, no problem.
Okay. Thank you so much, Dr. Nader.
Thank you, Dr. Nader.
Thank you so much. Have a good day or evening, night.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you, Dr. Nader.
You're welcome. Thanks. Assalamu alaikum, Paul.